Okay, so in this module, just there is patient preparation positioning, like for example, what is preparation positioning and what is the benefits, and therein then there is pew position, for example, supine position, prone position, lithotomy, jackknife position, kidney positions. Okay, so we will discuss first what is positioning. Positioning is defined as planning, if you want to write. Positioning is defined as planning the person in a proper body alignment. In a proper body alignment for the purpose of preventive, promotive, curative, and rehabilitative aspects. Rehabilitative aspects of health. Done. The second definition, the simple one, you can also write, or placing the patient in a good body alignment is needed therapeutically. Done. Okay, now the purposes are the goals to promote comfort to the patient, to relieve pressure on various parts, to stimulate circulation also, prevent nerve damage, prevent nerve damage, to carry out nursing intervention, to perform surgical and medical interventions, to prevent complications caused by immobility, to prevent complications caused by immobility. To promote normal physiological functions. Done?
Yeah.
Okay, so this is the definition and this is the purposes. Now there is few positions like Fowler position. Fowler position is also known as a sitting type position, like in the dental procedure. If you go there, the position is like. So this position is called Fowler, a bed position where the head and trunk are raised, typically between like 30 to 90 angles. Okay.
Sure.
Supine position already you know.
Yes.
And the next one, the jackknife position. Jackknife position, in this position the patient is laid down like prone position, but the hip Like here in the middle, for example, this one. For example, this is a bed, but the bed is like, you know that.
Raised up.
Yeah, raised here.
Oh.
Yeah.
Yeah.
The leg and the hip is down. The hip is aft, like Caesar.
Ah.
This is called jackknife position. And the next one, the kidney position, like lateral position. The patient is in the lateral position, but same, the bed is up here.
Ah, okay.
Like here is down, like same in the jackknife, it's like in the front.
Yeah.
But in the
Here
kidney
the
position,
side is-
lateral side,
Ah.
but it's up here. Okay, and the next one is lithotomy position. Lithotomy position is the position, usually it's used for the gynecological purposes. Legs are elevated up to the hip level or above. And the next one, Trendelenburg position. Trendelenburg position, like the bed, like for example this bed and it's raised.
Ah, okay.
The head is down, and reverse Trendelenburg, the head is up and
The body is
yeah. So this is Trendelenburg, and the same position is a position like it's also called like what you can say, like lateral and prone.
Okay. Got it.
Patient is lateral and prone, and the one leg is flexed to the chest.
Ah, okay. Got it.
Mostly they use in clean enema purposes or rectal.
Ah, rectal cleaning.
Yeah.
Ah, okay.
Okay. A rectal procedure sometime the.
They do enema here in the places separately or just washing out stomach?
No, they usually do a clean enema for the surgeries. If someone have too much constipations in the hospital, they do.
No other places.
No.
I was reading about coffee and
Yeah.
have you heard about it? Coffee? They inject coffee?
Coffee?
Ah.
No, I don't know about.
It's usually to detox the intestine. Read about it.
Ah, okay.
Same way the flushing out, they pump around like 1.5 liters of coffee into the system. Then 5 minutes they hold, and after that.
Ah,
flushes
okay.
out. So coffee,
I don't know about this because I didn't see this on
Yeah.
coffee. Okay.
So coffee, the caffeine hits differently. It's very interesting coffee.
Okay, but I didn't see.
Yeah,
it.
read about it. It's very
Okay, maybe it's used in some countries like developed, but here
Not
I didn't hear. Usually they use the clean enema or other medication. There is tablets or syrups. They give by oral, so it will be clean your. So these are the positions in this chapters. You already, and there is nothing else more. The physical therapist also may check. Already you know this. Like physical therapist will observe the patient, how the patient is walking, how the patient is sit.
Gait analysis.
Yeah. Gait analysis. So then we can move to the next module. Next module. Okay. The last one, prefix, suffix in this one, the medical terminology. Yes, sir. नहीं. So okay, so in the medical terminology. Yes. Some student there is. So in the medical terminology we will start, because in the medical terminology first you can write the definition. Is a language used to describe anatomical structures, procedures, conditions, processes, and treatments in the medical field. Done? Okay. So there are three main parts of the medical terminology. You can write three main parts. The one is called prefix, and prefix and root word. Number two, root word, and number third, suffix. So if, for example, these three are present in one word, so it will be always in the order form. The first one will be prefix.
Okay.
The next one, root word. And the last, suffix. So for prefix, you can write prefix will always, it's a letter or group of letter which will come before the root word. Prefix, a letter or group of letters which will come before the root word. Hi, how are you? How is everything? Done. Root word is a word part which will give you a basic meaning. This is the main word part of the word. Root word. Root word will give you a basic or specific meaning of the word. And suffix. Suffix is a letter or group of letters which will come after the root word. Done?
Yes.
So you already know it will be always in the order form. For example, maybe there is some word, there will be no prefix. There will be root word and suffix, but it will still in the order. The root word will be first from the suffix. Okay? And for example, antibacterial. In antibacterial, you know there is one word that giving you a basic, a specific meaning. Yes? Bacteria. So bacteria is the root word. Anti is the prefix against, and al is pertaining to it is the suffix. For example, there is some words will be no prefix. There will be two root words maybe, like for example osteo, arthritis. So in osteoarthritis there is two root words. See, osteo also a root word because bone, and this one is joint. So this is two root word, and there is itis is the suffix. You got it, yes? And there is also combining vowel, the fourth one, the combining vowel. Like for example, for combining vowel is there is no other like combining vowel only the word make the word easier to say. Like for example, cardiology. O. So it's only makes the word easier to say. So if you want some few root words, it will come in the exam maybe. I can give you, or if you want in the notes, I can share you later in the picture. Like for example, arthur, joint, bio, life. Yes? Cardi mean heart. Carcine mean cancer, carcinoma. Sepal mean head. Okay. Dent mean teeth. Yeah. Dermata, yeah, skin. Enter, enter. Enter means intestine. Intro. Gastro means stomach. And there is few suffixes, prefixes like anti mean against. Bradycardia means slow. Tachy mean past. AP mean above. Okay, hyper already you know, excessive, more than normal. And hypo mean low, yeah, lower than normal. So Peri means surrounding. Okay, and suffix is algia. Algia mean pain, myalgia for example. Oma mean tumor, carcinoma. Osis mean condition. Globin mean protein. Gravida mean pregnancy. Done? Akash, done? Okay, there is nothing more else. There is some prefixes, suffixes I will share with you.
Sure.
But in this module only you should know that prefix, suffix and root word. Prefix will always come before the root word. Root word is the word part that giving you a basic, a specific meaning. And suffix will always come after the root word. You want break? You want coffee, something? Lorely, how are you? Which module is missing for you? He want to finish it. He is in the... Huh? We already do this now, na?
But yeah, but not the the full but
Hmm?
you know many things here is I know already, but of course I did not a little bit I've read a little bit from
Yeah, in this module only the important thing is prefix, root word, suffix. What is prefix? Prefix is letter or group of letter which will come before the root word. What is root word? Root word is a word part that giving you a basic meaning of the word. Specific meaning, for example, antiviral. So virus is the root word. Okay. And what is suffix? Suffix is a letter or group of letter which will always come after the root word. This is the important thing. If you understand these three,
I understand this, sir, but actually I did not taking up with you
okay.
the past
Okay.
class.
Okay. Okay, so this three already you know now. Prefix, root word, suffix. Later we can also discuss, no problem. Now we will go to the second module because Lorely. So how are you, Lorely? How was your vacations? You didn't come for many weeks. Lorely? And say how are you?
This is probably they always that's why it's like we got sick always because of the weather.
Yeah, the weather is changing. This is a problem.
It's not feeling well always.
This is the problem. Yeah, I understand. So, Akash, in the patient care administrative, okay, first we will discuss little bit administrative sides, then we will go to the patient care. So, what is the healthcare administrator? For example, what is the healthcare administrator? Medical and health services managers, if you want to write. Medical and health services managers, also called healthcare administrators. Plan, direct and coordinate medical and health services. This is their jobs. Plan, direct and coordinate medical and health services. They might manage They might manage an entire facility or specific clinic area or specific clinical area or department. Okay, what the healthcare administrator do, like job responsibilities? Okay, work to improve, you can write the responsibilities. Work to improve efficiency and quality of the facility. Quality. Develop the departmental goals and objectives. Develop departmental goals and objectives. Recruit, train, and supervise the staff. Manage the finances of the facility. Prepare and monitor budgets. Prepare and monitor budgets of facility. Keep and organize records of facility services. Keep and organize records of the facility services. Ensure that facility in which they work is up to date. In which their work is up to date and compliant with new laws and regulation. Represent the facility in the meetings. Done. Okay, so the skills of the good, like if you are administrator, which skill should be in you? Communication skill, number first one, good communication skill. Leadership skills, technical skills, interpersonal skills, detail oriented, analytical skills. Done. Okay, now the next one, patient administration system. What is patient administration system? A patient administration system, PAS, PAS also, it's called PAS. A patient administration system and information service providing a foundation to all healthcare it's perform the basic but crucial functions. It's perform the basic but crucial function of recording non-clinical patient details. Non-clinical patient details. For example, like such as name, date of birth, home address, as well as any additional contact details for the next kin in an emergency. Done. Why is the PASS system? Why is the PASS patient administration system? Patient registry, managing waiting list, billing, managing appointments, okay, log into patient activity, reporting, hospital admission and discharge. What is the benefits of the patient administration system? It will reduce the administrative cost, it will improve the data accuracy, okay, it will also save time and deliver high quality services. Done. Now patient care. What is patient care? Patient care refers, if you want to write patient care, patient care refers to the prevention, treatment and management of illness, and the preservation of physical and mental well-being through services offered by health profession. Done. Patient care done. What is patient care? Okay, now there is three main types of the patient care: supportive care, palliative care, and hospice care. Supportive care, already by the name you already understand, the care and support for the patient living with serious illness, okay, and advanced care planning education, initiate goals of care discussions, symptom assessment. Hospice care and palliative care, for example, this is hospice and this one is palliative, and here both. So in the similarity in both are specialized care, okay, both are for the patient who are suffering with the serious illness, for example cancers or the terminal in the last stage. But in the hospice care, the prognosis will be 6 months or less than 6 months, okay. Hospice care used when the prognosis is 6 months or less. Palliative care, the next side, used at any stage of the disease. Hospice care again, no curative intent. No curative intent. Palliative care, the other side, have curative intent. Hospice care again, hospice care provided in home settings. Provided it in only home settings. Palliative care provided in clinical and home setting both, because there is still treatment in the palliative care, but in the hospice care the treatment has been discontinued, stopped. Okay, in the hospice care treatment has been discontinued. In the hospice treatment has been discontinued. Palliative care still can be paired with treatment. Can be paired with treatment. Done, Akash?
Yeah.
Now you understand hospice and palliative. Both are for the people with serious illness. Both are comfort care, in both pain management, and both symptom relief. But the difference is used with the prognosis is 6 months or less, used at any stage of the disease. No curative intent, and palliative care have curative intent. In the hospice care, the treatment is being discontinued.
Yeah.
And the palliative care, still the treatment is continued, can be fed with the treatment. Done. But in this module, what like they put patient care administrative, but they put something else, physical therapy documentation, and where the physical therapist can in work, pediatrics, sports, women health. Yes, we know this clinical, neurology, orthopedics. Okay. So in the documentation, we have SOAP in page 57. SOAP notes 57. Page number 57. So subjective, S mean subjective, O mean objective, A mean assessment, F mean plan. Subjective, what the patient say about the problem. Objective, the therapist objective observations. Okay. Assessment, the therapist analysis. And the plan, how the treatment plan. SOAP notes. If you've got examples, if you want to take this one. Okay, range of motion already you know it. Okay, the movement potential of joint from pull extension to pull flexion bending. And what else? Vital sign in this module. Vital sign for the blood pressure. But I will give you. Blood pressure already you know 120/80, and the temperature 36 to 37.5 R2, and the oxygen saturation should be 95% to 100%, and the breathing rate should be breathing or respiratory rate should be from 12 to 20 per minute. All vital sign is there. And what is vital sign? Vital sign is the measurement of the basic body functions. I will give also the sugar chart to you. But this is the blood pressure chart. You have these already? You know already about vital signs? You know it. I will give you, I can provide to you. Okay, for the CPR already, you did BLS, yes? So you know it. CPR 30 compression and 2 breaths, rescue breaths. Then the speed will be from 100 to 120 per minute. The pen scale already you know 1 to 10. Yeah, from 1 to 2 is mild, and then moderate, and then severe, and then too much severe, and then worst. Almost done. There is nothing more else. Okay, for exam, in the evening time, you just contact with me later in the night, so I can give you some more, like how will be the question and how. Theory.
You can write it or this specifically?
No, it's up to you. Anytime you will come here. Anytime, any day you have time, you will come here for the theory. From your mobile, you will give exam, and then after theory, one day, or maybe you want on the same day, we can do it, like Viva exam, oral, and some practical. Practical already, I know that you are, okay. And then after for the MCA exam, when you finish this exam, everything done, then you will tell them to the guy here in the Padil to register me for the MCA.
Sure.
What,
So they will register you MCA. Then MCA will send you some email, some password, something. Then you will open the account there in MCA, and I think 2-3 weeks they will give you a date for the exam. They will also send you some materials, some notes. Also, I can provide to you. Then on that day, you will come here. You will choose the date and timing. So from the laptop, you will give exam to the online to the MCA. There is 90 minutes. Yeah.
what first exam supposed to be, or usually you will take like oral exam first, or?
No, not theory.
Or,
Theory exam from the mobile. You will give theory. Yeah. After that, practical and oral is same together.
And then when you will going to give us the point of review, or like what we were going to review, like this.
For the exam,
The exam.
when you want to appear in exam, just tell me. Then I can give to you.
Maybe next Friday.
Next tomorrow, Friday.
Next.
Okay.
At least I have that.
1 week.
1 week.
Okay.
I'll do it next Thursday.